is to get essentially an AIDS update.
Okay.
See, and starting with whatever the first 6 minutes, background, education, that that second segment is 8 minutes, and whatever you want to talk about, AIDS update 2015, and sort of bring us up to where we are now in reference. Could you please get that?
Yeah.
Where we are now up to dealing with that, because when you first came to us, well, I guess it must have been 81 or 82. When,
no, it was probably the early 90s. Yeah.
You just say your name and count to 10 for us.
Now?
Yeah.
Ron Crowder. 1, 2, 3, 4, 5, 6.
Thank you.
Okay, and so so what I want to do is this is your show, as
Okay.
always.
Okay.
So and you gave us some information about Viagra one time, and when Viagra first came out, and about how dangerous it was in terms of encouraging the old men to get things, made them put them in the class. We've had
we done had some pretty good shows.
This is a real sex show here, because we're dealing with the sex issue.
Yeah.
That's right. AIDS ain't changed since.
Well, now most of the infection rate is in MSMs, and that's men who have sex with men. CDC put all their money in MSMs, young black MS. As a matter of fact, okay. On the TV show. Okay. All right. Okay.
I can't say, well, Crowder told me that I can.
Yeah. And
that's what we want. That's what we want to do, Crowder, just to give you an opportunity to talk about what you've been doing and Streetworks and some of the things that are important. I think that you might have received a little money in terms of grants and what the government is doing, and what the state is doing, and et cetera, and what has to be done or what can be done in terms of helping to alleviate this issue, because I don't think that you hear as much about it now.
Right, and I'm gonna talk about that too. How people don't become complacent because you don't hear about it.
But it don't mean it's not there.
Yeah, we'll talk a little bit about that.
Okay, good. And so we'll have that first 6 minutes background education experience, and then we'll come back with 8 minutes. And each time that we have a break, we can get organized in terms of what we're going to talk about.
Okay, sound like a plan.
This is the last of 5 shows for me today, and you can hear my voice. I'm fighting it now. All right. So that first segment is 5 minutes and 55 seconds.
Okay.
Thank you and welcome to the show this morning. The topic this morning is AIDS and Streetworks. And we're fortunate to have with us to talk about AIDS and Streetworks, Ron Crowder. Mr. Crowder is the CEO of Streetworks, and Mr. Crowder has been with us on a number of occasions. And Mr. Crowder, let me not only welcome you to the show, but to give you an opportunity to inform our audience in terms of who you are and how you became involved with AIDS and some of those issues, and then we'll get into other aspects. But let's use the first 6 minutes to simply identify Ron Crowder, who is the CEO of AIDS Streetworks.
Yes, Dr. Haney, thanks again for having me to come back to the show. As you said, I'm Ron Crowder. I the founder and the CEO of Streetworks. We was founded in 2000. I was diagnosed with HIV in 1991, hence my involvement in the HIV/AIDS work. So again, we've been around since 2000. We have three locations, one at 520 Sylvan Street in the James Casey Homes. We have another office at 83 University Court in the Tony Sudicum Homes. And when our newest office is at 1709 Church Street, which is at Out Central. It's a LGBT outreach location.
And so you, not only are you involved in it, but you're actively involved in helping to create situations so that you might be able to aid others.
That is correct.
Doing that.
That is correct. Our services include medical case management services, housing services, nutritional services, early intervention services, psychosocial support services, mental health, substance use services. So we have a full continuum of care.
And you know, Ms. Crowder, one of the things that we always talked about when you visited us earlier was AIDS. What is AIDS and HIV and et cetera? So I know it might be old with you in terms of having talked about this time and time again, but there might be a few of our members of our audience this morning that might not have any real idea as to what we're dealing with when we talk about HIV and AIDS.